Welcome, everyone. Thank you for coming to Global Health Education Day. The Center for Global Health Education is very proud to present global health education to you all. My name is Ashti Dubey Prasad, and along with Bill Leonard, we co-direct the Center for Global Health Education. The center's mission is that we support and administer transdisciplinary global health education at Northwestern and across the globe. So welcome everybody. Again, we're really delighted to have you all here to welcome you, and we're very excited to be together and be in person after such a long time. And so we're really grateful for you all coming at this point. We know that it's, these are some of the first times being together in a long time, and I can feel the energy, and it's really terrific to be here with all of you. And we're excited to celebrate the achievements of our learners. We really have enjoyed those posters and seeing all the work that everyone's done. And we're also very excited to learn from our distinguished speakers today. So this year, our theme is advocacy. And we are really, our speakers are going to challenge you to think about yourself as an advocate. And our speakers, both Lise Saffran and Juliet Sorensen, will be talking to you about different ways to think about advocacy. Lise will talk about how we can mobilize for action using art and literature, and Juliet will share her work and her stories and avenues for advocacy in health, human rights, and law. I want to congratulate everyone on all the learners on their terrific posters, and I want to thank our speakers for coming from far and near, and also our judges, Shannon, Anita, and Kate, and Bill, of course, and our center leaders, Shannon again, Bill, Liz, Colleen, and Leah, for all their hard work, and really most of all to Sada, who has done a tremendous job putting everything together. It's really, we're so grateful. So thank you everyone for coming. And you've already experienced some of the agenda today, the lunch and the poster session. And now we will have the keynote address. After that, we'll have a short break. And you can go look at the posters again. And then we'll have our second plenary talk from Juliet Sorensen. And then afterwards, we'll have awards, poster awards, as well as a networking reception. So that's our agenda for the day. Housekeeping, you can ask questions at the end of each talk. We have live streaming as well, so remote participants can use the chat feature to submit questions. And we really ask that you wear a mask during our event. So without further ado, I'll read your bio quickly, and then we'll have you get started, Lisa. So Lise Saffran is an associate teaching professor at the University of Missouri, where she teaches storytelling in public health and policy. She has degrees in public health from the University of North Carolina School of Public Health, now the UNC Gilling School of Global Public Health, and creative writing from the Iowa Writers Workshop at the University of Iowa. Her research and teaching focus on the ways in which storytelling can enhance self-awareness and cultural humility in public health practice and improve communication around significant issues of public concern. Her academic papers and creative nonfiction have been published in or are forthcoming in The Lancet, PLOS One, the Journal of Medical Humanities, Academic Medicine, Scientific American, the Chronicle of Higher Education, the Journal of Applied Arts and Health, Poets and Writers, Orion, and elsewhere. The recipient of fellowships from the MacDowell Colony and the Hedgebrook Community of Writers, she has published short fiction in the Crab Orchard Review, Gulfstream Magazine, Puerto del Sol, Granta Books' Family Wanted Anthology, and is the author of the novel Juno's Daughters. Welcome, Lise.
All right, let me pull up my, I am so very pleased to be here. Dr. Dubé-Prasad did give me permission to take off my mask while speaking. So if you are uncomfortable, I'll give you a moment to move back a little bit. I would like to thank my friend, Dr. Dubé-Prasad and Dr. Leonard and the rest of the team for bringing me here. I don't know if you know this, but I was supposed to come 2 years ago, and I think it was February or March, and that was postponed. And it is just such a joy and a delight to be with all of you and to have seen some of your posters. And I hope to have an opportunity to talk to you later. So I'm going to talk for about 40 minutes. And then I hope there will be some time for conversation, for questions. So please, as things arise, take a note. And I would love to hear from you. This talk, can you hear me okay? Do I need to stand closer? This talk will include, I'm going to be reading some excerpts from a published piece and a soon to be published piece. The published piece was an essay in The Lancet on climate change and art and literature called The World Behind the World. The longer piece that I will also be reading from is part of a global health humanities grant, interdisciplinary grant at Texas A&M University. And so that manuscript is going to be in the archives at Texas A&M, and it's called Apocalypse Chocolate and Crossing the River, a meditation on infection, community, and grief in a changing world. So I'm a public health professional, a creative writer, and a health humanities scholar. Oh, and I also have a way to advance these slides. Okay, there we go. At a recent PhD defense in creative writing, one of my fellow committee members said to the candidate about her collection of essays, "Good writing essentially involves posing a series of questions." Public and global health also involve a series of questions, each thornier than the last. These include, why do people do what they do? Why do they continue to do it even when they know sometimes it might make them sick? Why, when we know that people's circumstances determine their choices, do we maintain systems in which it is so hard to choose? How can we get people to care more for each other? And when it comes to the biggest global health crisis of all, climate change, the question is this: why do we seem paralyzed in the face of an existential threat that puts everyone we love and everything we value at risk? So I first learned about normalcy bias in connection with the odds of surviving a plane crash. In the 90 seconds that survivable plane crashes offer you to get out alive, normalcy bias is the belief that the present catastrophe cannot possibly be happening, can cause people to sit in their seats even when the cabin fills with flames. In February, the IPCC reported with very high confidence that, quote, global warming reaching 1.5 Celsius in the near term would cause unavoidable increases in climate hazards and present multiple risks to ecosystems and humans. The data is strong, and it has been for some time. We love data in public health, but somehow the evidence of what is happening does not appear to be enough to move us to prevent the catastrophe from worsening. We are divided and we are in denial. In writing about his work on motivated reasoning and in science communication, Yale psychologist Dan Kahan points out that never in human history have we known so much but agreed on so little. Health humanities asks us to engage with art and literature, but the answers we seek are not hiding in a poem or a painting or a novel. In this talk, I will suggest that health humanities, and in particular, the creative arts, offer us a methodology that is uniquely suited to a planetary crisis in which the challenges we face seem almost beyond imagining. The creative arts offer a methodology for listening and seeing that allows our minds to perceive subtext, to be surprised by strange connections, and to be moved. In the words of one of my favorite contemporary poets, Ada Limon, she says, quote, "One of the things I love about poetry is that it's slippery. It can move in between worlds. It doesn't have to offer clarity or hope or vision. It only has to make us pay attention to the world. So how might art and literature move us to action when data and evidence have so far failed to do so? The evidence warns us that we are facing circumstances that we as a species have never before experienced. Normalcy bias is based on the assumption that if the disaster hasn't occurred until now, it won't occur. It is, in essence, a failure of imagination. So a brief review of dual process theory may help illuminate how art and literature may play a role that data and science haven't in igniting our imaginations. And so then I'm going to bring in Mr. Tiger here. So dual process theory describes the two main frameworks that we draw on when processing information and to make decisions. There are intuitive or heuristic processing system, which is sometimes called type 1, and our analytical or deliberative system, which is sometimes called type 2. The first type involves putting images, feelings, memory together rapidly to make meaning, and it's the older system, and it's, like I said, faster. The second system is the one that we usually use to coolly assemble information and come to a logical conclusion about something. Human beings are complicated, so sometimes those systems are working in sync together, but often we tip in one direction or another. And when the two systems are in direct competition, the fast one, the heuristic one, wins. So that's where we get to the tiger. So let's say you're walking through the jungle and you see a creature that looks like this. If you can very, very quickly, without too much thinking, put images together, the claws, the teeth, the stripes, together with your experiential knowledge of what a tiger is and run, you might survive. If you coolly and logically assemble a list of characteristics that a tiger has and go through those and compare them to the creature that you see in front of you, you are probably lunch. And it's not just tigers that stress us out in the modern world or threats to our physical safety. It's not just those kinds of threats that kick us into heuristic processing. It's threats to our social and political identity, our values, our future. They all cause our fast processing system to take over, to cause us to make meaning out of vivid fragments of information and put them together in a story. And if this seems like a system that it has room for error, you're right, it does. There are all kinds of assumptions and false conclusions that one might come to. But it's important to also to remember that our analytical systems, especially when we feel under threat, are put under pressure by our fast processing systems. And sometimes our analytical processing systems, that information, it seems like we're processing analytically, but we're really not. And so I mentioned Dan Kahan earlier. He did some other elegant research with colleagues looking at motivated reasoning and political and social ideology. And they were looking at whether or not the assumption that with complicated scientific topics, increased scientific literacy would make people less inclined to engage in motivated reasoning. And so they did some message testing, and what they found was actually the opposite. When it came to highly politicized science topics, the people with the very developed analytical skills and the high scientific literacy, were actually better at motivated reasoning and more likely to be farther apart than those with less scientific literacy, because the analytical skills were put to work in service of the motivated reasoning, figuring out the cues of the sources and whether those sources were part of your ideological team. So getting back to normalcy bias, if normalcy bias allows the brain to smooth over frightening signs so we don't see them, the crack in the street, the smoke in the air, the gun in the stranger's hand, then the real power of art and literature is to allow us to make connections that render even familiar things porous and strange. They alert you to messages hiding behind silence, to subtext. The communication scholar Walter Fisher describes human beings as narrative creatures. He notes that we construct narratives out of fragments to make meaning. It is an intuitive process, this meaning making, and it's one that kicks in under stress. Art and literature send messages to our fast processing system with their vivid imagery. They disrupt our automatic responses so that we might let in new information. So an example of the way we ignore the fast processing system to our peril is the way that American students and trainees are often prepared to go abroad. So here I have, remember this is there we go. So they're frequently, as part of the preparation, given case histories or situations to think about in light of cultural information that they've learned. So they're essentially asked to use their analytical processing systems to solve little puzzles about behavior and ethics and power. So I've taken several groups of American students to Ghana, West Africa on public health study abroad. And I will say that very rarely from the time they step off the plane in Accra to when they board the plane for home, are they engaged in analytical processing of any sort. So in a dual processing framework, that information that they've learned, logical information that they could put together in an argument, isn't even accessible to them when they're standing by the road waiting for a bus that may not come, or visiting a clinic that is unfamiliar and chaotic seeming, and which their own role there is confusing and fraught. They are working hard to make meaning. They are reacting under pressure. They are filling in gaps in their knowledge with assumptions and stories. So what if we prepared them instead for that state of being, with material that challenged them emotionally and made them use their imaginations, and presented the world as stranger, more porous, and more shifting than what they typically believe it to be? What if instead of puzzles, we had them read Chris Adrian's short story, A Tiny Feast, in which fairies navigate a pediatric oncology ward in the mortal world? When the child that they've stolen falls ill, they disguise their magic with spells before taking him to the hospital. Quote, everything was filtered through the same normalizing glamour that hid the light in Titania's face, that gave her splendid gown the appearance of a tracksuit. So when tragedy strikes, the spell of normalcy that has been spread thinly over the world falls away. The unbelievable can no longer be ignored. Quote, people saw them for what they were, 102 fairies and a dead boy proceeding down the hall with harps and flutes, crowded in the service elevator with fiddles and lutes, marching out of the hospital with drums. Mortals gaped, dogs barked. Art and literature don't just allow us to see the world and what is happening to it more clearly, they allow us to see each other more clearly too. That's where empathy comes in. Tackling a planetary crisis, whether a pandemic or climate change, requires that we understand in a deep way that we are connected. In an op-ed addressing the proposed elimination of the National Endowment for the Arts by the Trump administration, Chicagoan Eve Ewing wrote in the New York Times in 2017, quote, art creates pathways for subversion, for political understanding and solidarity among coalition builders. Art teaches us that lives other than our own have value. But empathy, like stories, is complicated. Empathy that is insufficiently curious and humble and respectful of others and tolerant of ambiguity can flatten the experience of others. It can make us clumsy and unethical instead of sensitive and connected. And that's one of the reasons in my work in storytelling and public health, I often engage students in exercises around fiction writing and characterization. I have students imagine a health behavior that they find deeply unsympathetic, and then build a character around somebody who they imagine might engage in that health behavior. And it's important that it's an imaginary person, because as they build that character, they begin answering questions like, what is this person's character's biggest regret? What do they love? What is their hidden talent? And so one of the dangers of empathy is that you feel so much for someone else's experience that you imagine you know their experience, and you forget that they are a mysterious individual with a very different life and an inner world that you don't have access to. And so with the fiction writing exercise, if the participant imagines the health behavior to be, say, taking drugs in front of one's children, and then imagines the hidden talent to be juggling, they're not going to go to the next person they encounter who engages in that behavior and say, how's the juggling? But what they hopefully will remember is that that person is a fully complicated person beyond the mysterious behavior that they don't understand. So as a creative writer, my focus is primarily on stories. The stories we tell when we walk into an exam room, when we enter a community that is not our own, when we contemplate the future in light of the present and the past. These stories affect how we perceive others and ourselves. They impact what we can and will do. Because of that, they are consequential, and they confer ethical responsibilities on their teller. So the goal of this work is to engage with the humanities in order to shift the way we see ourselves and the world by cultivating the attributes that ethical storytelling and true empathy require: curiosity, humility, the tolerance of ambiguity, and respect for others. So this is a challenge I grappled with intensely for the recent Global Health and Humanities projects at Texas A&M University that I was involved with. An interdisciplinary team led by Jessica Howell in the Department of English collected oral histories about Ebola and malaria from people in Sierra Leone and COVID-19 from people in the United States. So my role was to create and draft a creative manuscript referencing the interview text, but without any direct contact with the participants at all. So what I ended up writing was what I call a nonfiction collage, kind of a jumble really, that blended excerpts from the interviews with historical and contemporary research that I did into infectious diseases and colonialism, and then combined that also with my own creative writing, personal reflection, and personal creative nonfiction. So I'm going to read you from just a small part of that manuscript now that's in progress to give you a sense, because a lot of it was very self-reflective. How does this methodology actually work in practice? So, and as I mentioned before, the full manuscript is entitled Apocalypse, Chocolate, and Crossing the River, a meditation on infection, community, and grief in a changing world. And it's going to be in the archives at Texas A&M. So I was given these interviews, the oral histories, with not a whole lot of explanation. And so the first interview that I read from the Global Health and Humanities Project was with a woman who had lost 4 members of her family to Ebola, including her own child. She herself had been gravely ill with the disease. So a saying of unknown origin, which is often attributed to the Talmud, reminds us that we do not see things as they are, we see things as we are. So the first interview was both a window into a world I did not know, and it was a warning light that I should remember I did not know it. I had been to West Africa several times, but never to Sierra Leone. The interviews are anonymous, but I read that the woman worked for a non-governmental organization before she became infected, that she earned a diploma from Eastern Polytechnic, where she had gone to secondary school. So I'm a white American woman, a Californian in Missouri, and a college professor. I am also the mother of children who still live, 2 young men. In the words of the Channa Block poem, Annunciation, that carried me through a recent time of loss, I am blessed with 2 children 2 freestanding sons. So this was from the very first interview I saw, and it was conducted on the 28th of December in 2018. And I didn't know the gender of the interviewer or anything about the person at all, really, other than that they were from Sierra Leone. Interviewer: how many of you in the family were infected? Interviewee: 9 of us were infected, but 4 survived. Interviewer: who died? Interviewee: my mom, my sister, my 2 brothers' wives, and my daughter. Interviewer: how old was she? Interviewee: 4. Interviewer: did your dad survive? Interviewee: yes, my dad, my younger sister, my younger brother, and I survived. Interviewer: how did you access treatment? What stood out to me most powerfully was what was not there, what might have been there, the gaps. Why did the interviewer move on so quickly, I wondered, from the daughter's death? In reading subsequent interviews, I would wonder why so many of them focus on administrative aspects of the Ebola outbreak and malaria response. But what do I imagine I might have asked if I'd been in the room? Can I imagine the room at all and the people in it? And if I can't imagine that, can I reasonably imagine a question? And yet the questions that came to me, because questions never need to be invited into a room, they just come, were these. What stories did your daughter ask you to tell her? What songs did you sing when she died? Would it, I wondered, have included a song sung at graveside ceremonies called Tanjami, crossing the river, that made the journey to America in the hearts and minds of enslaved Africans? As depicted in the documentary, The Language You Cry In, a version of that song would be later sung by the Gullah people of South Carolina in the United States. I am a mother who has her children still, but shortly before the pandemic began, I left a marriage that had lasted all of my adult life. Having met my husband at 20, I was now 56 years old and divorced. What would this woman have made of a poem, The Panic of Birds by Elena Kaltiak-Davis, that I read so often during those first grief-stricken months that I could recite it in my sleep? The last stanza goes like this. Wind against window and my late flowering brain, heavy, gone to seed. Pacing from room to room, and in each room, a different version of a framed woman, unable to rest. Set against the sky full of beating wings and abandoned directions. Her 5-chambered heart filling with the panic of birds, asking, what if not this? If the woman from the interview had been sitting in my kitchen with me, perhaps I would have asked her, what songs did you sing to yourself to keep yourself alive once your daughter was gone? The transcripts may contain gaps, but this is always true of the mysterious behavior of other human beings. Why do we do what we do? My own perspective amplifies those gaps, even as it attempts to fill them with my own experience, assumptions, and stories. Curiosity requires that I focus on what I do not know. What were the instructions the interviewers were given? What were the demands of the project? What was said just before the interview started? How is the invitation phrased? Before I can even begin to tell a story that includes these interviews, I need to ask myself, where do I go for the education that I need? How does this combining questioning and creating work? So I researched the history of malaria in West Africa, including the depiction of the disease by European colonizers and missionaries who referred to Sierra Leone as the white man's grave. I researched the suspected origins of Ebola and the link between zoonotic disease and habitat loss. One morning in October, I read the excerpt exchange from the oral history to 2 Nigerian colleagues over Zoom, and I asked them what my questions are missing. Judy Dada is a Nigerian screenwriter, actor, playwright, and producer, and Chinaza Ezigala is a Nigerian medical doctor and writer. I asked them, what am I failing to understand because of the limits of my experience, my culture, and the assumptions I'm bringing? This is not a conversation, they remind me. It is something that will be included in an official report. There are economic considerations and considerations of power in any project that is funded from outside the country by grant money. The interviewee might be considering what the interviewer needs to produce in order to have succeeded in their task. I think of this when I read the following exchange with a woman from Urugu, Upper Allentown Reservation View, who, when assured that her responses will be kept confidential, replies, interviewee, "This is a sort of information to the government. Maybe they do not know. They're just coming in. As an NGO, you can make your recommendation about what you have gathered from the interviewer, because that is the essence of the interview, to hear people talk. We want people's voices to be heard, not just people in the government, the people who have lived these things." And what of the civil war that had raged in Sierra Leone a decade before these interviews were conducted? Very few people even brought up the war. And I wondered how that communal trauma lingered in the lives of individuals and communities impacted by Ebola. The brief exchange below was one of the very few references to the war included in any of the transcripts. It was with a pharmacy student married with children. Interviewer, "Why did you come to Freetown, particularly Hastings?" Interviewee, "My parents and I came to Freetown as a result of the Civil War. We were forced to move from Kenema to Freetown." I arranged another conversation with my friend Juliet Sorensen, whose memoir Siberian Exile weaves together family narratives and archival material of World War II in Europe. Because this is an oral history project, we discuss Voices from Chernobyl by Nobel Prize winner Svetlana Alexievich, in which World War II is ever present, even though the Chernobyl disaster happened in 1986. I posed the question to Julia, "Why do you think no one mentions the war?" And her response is this: "In my experience, it takes a generation before people will speak of it." The gaps grow as I do my research rather than shrink. Humility in this case demands that I recognize my inability to be the guide to this material. So I begin to approach the transcripts differently. I pass my eyes over the words and sentences, looking for light. I read them out loud to myself, listening for resonance. What might these people be saying to me when speaking out of their experience about my world, our world? And I'll give you an example of one of the sentences that jumped out with someone talking about Ebola. So I'm looking for resonances, and I read that and I think, I don't know exactly what that person meant for themselves, but I know that is resonating with my experience right now in this moment and in our experience. Malaria is spread through bites from an infected mosquito. Strategies to prevent the spread of malaria include sleeping under bed nets, using repellent, and covering the bare skin on your arms and legs. The prevention of Ebola, on the other hand, required people to behave in strange and new ways, some in direct opposition to traditional ways of honoring the dead. I think of that when I read the following exchange. Interviewee, "It was a very bad experience. Our people refused to accept the fact that it was Ebola. If you had to go to the market, you would plan for days about what to put on." Interviewer, "What do you mean? Is it clothes that will cover you?" Interviewee, "Yes, clothes that will cover us. Long sleeves to be precise, in order to avoid body-to-body contact." A creative work is not a test. There is no right answer. The third attribute is the ability to tolerate ambiguity. I try to suspend my conclusions, to hold the story open for as long as possible and just listen. When I listen hard to the voices on the page, what echoes is this: new disasters coexist in time with familiar disasters. They require new strategies because the old will not work, but there is little time to adjust. Disasters accelerate, overlapping like waves breaking on a beach. In the spring of 2021, the Global Health and Humanities Project expanded to include a focus on Americans and COVID-19, and the echoes grew louder. This is from one of the participants in the American COVID interviews, quote, "It can all go to hell really fast," says a woman with long COVID from rural Wisconsin, "so much faster than you think it can. And we spend so much time worrying about things we think we can see coming." Art and literature nudge us to look beyond the normal and the familiar and the expected. Ada Limon says to pay attention to the world. And then I would add, and to each other. They remind us that each person seated around the conference table has a head full of whispered fears, remembered slights, secret hopes, odd desires, and an unruly mortal body. Collectively, we appear to be hovering near a comparable, shattering realization about this solid planet teeming with life. It cannot be fragile, can it? Cannot really be changed. I believe we need to entangle art, music, and literature closer together with climate science, and we need to do it now. We need the humanities and global health, and most urgently in grappling with the climate change emergency, because we need a way to connect the story of scientific collapse that is unfolding around us to the language that we use to talk about the things that are hard to talk about and hard to imagine. Art, literature, philosophy, and music remind us that the unimaginable happens all of the time. They give us an emotional language to talk to each other about those things. And they give us the courage to see them. Thank you. Thank you. I don't know if we have questions or thoughts. Or from online. Do you want, while you're thinking, do you want me to tell you what the apocalypse chocolate part is? Okay, so that part is not part of this presentation, but the personal writing that I did has to do with that sense of disasters preparing for the last disaster, because those are the instructions that you were given. And not necessarily grappling with the current disaster and how unexpected that is. So there's a personal essay that's woven throughout this longer piece that has to do with, you know, I'm a Californian in Missouri, and when California was going through, now it's every year, but a big wave of wildfires, I was participating in a lot of the social media with my family and friends, hearing about what your go box should look like if you have to run. So, you know, being kind of the neurotic mother, I had 2 children. They were almost grown, but not quite grown. You know, I did all the things. I packed the box full of like solar lanterns, our documents, Band-Aids, first aid kit. But the instructions also said, you know, plan for you know, moments of pleasure for your family. Like, you know, if you have kids, throw some chocolate and some fruit leather in the box. Make sure you have like your passports, your social security cards. All of that was packed in the box. But then, of course, I was much too far away in Missouri for those fires. And so then when my husband and I split up, and I took the box apart and I handed him his documents and all of those things. And then the box went back in the closet somewhat lighter. And then there was the lockdown, and both of my children and I were home alone. And that's when we broke out the apocalypse chocolate. It's like, all right, what do you need? And my kids would come into the kitchen and say, do you got any more apocalypse chocolate? And so the box grew lighter still. And then eventually my older son left home, and my younger son and I said, well, it's, you know, we're going to wait till as far as possible into fire season before the presidential election. And we're going to throw our stuff in the car and move to California. And so the box was lighter still. And we had a very small version of that box, threw it in the car, and went seeking a new life. So you can see where some of these threads in a collage kind of overlap, and it's not quite done. The thing still has some work to do. What would you, oh yeah. Any questions or thoughts? Doesn't have to be a question. Yes. Oh, sorry. Sarah's in charge, I think.
I can try to.
Okay.
Thank you so much for that presentation. Thanks, Sarah. Hi, I'm Shannon. I really enjoyed your presentation just now. And what I was wondering is, how different really are the two ways of thinking? I guess my question is more, those of us who feel like we deal more in data or kind of empirical science, we still have a narrative bias, right? And so most data is usually, is it really that data is used in service of a narrative, or that we get the narrative for the data? Do you have a sense of how most people use that?
All those different ways. I think that what I see the most, and why a lot of the time why I do this work that I do, is that those two systems are both really functional and useful and necessary for human processing. We don't want to dispense with our analytical system at all. What we need to do is be much more self-reflective about how they interact, and being sensitive to where the messages are coming from. And so what I find really useful and interesting about teaching narrative, storytelling and narrative to people who really focus on science is that there's a lot of resistance to the idea that narrative is involved. I mean, maybe in the communicating of it, but not in the interpretation, certainly not in the asking. Like, it's involved from, we just wake up in the morning and we are engaged in narrative. And the most dangerous kinds of narrative are the ones that we're not aware of. And so that's why I think it's just really, and like, so Dan Kahan, it has some really interesting ideas about how to decouple kind of social and political identity from science communication, but certainly being aware that this is happening is the first step. Does that answer your question?
Yeah, that makes a lot of sense.
Okay.
I think even just having the awareness that we all are using a narrative construct, no matter what we're doing, how much data we're quote interpreting or utilizing in our kind of day-to-day thought processes.
Because like, I had just recently read my student evaluations from the spring, and it was, I know this is happening, but it was interesting to see a student actually explicitly say that. She said, I really love this class. I teach storytelling. I was at public health capstone for undergrads, but I really struggle with feeling like like learning about this was dangerous because I was going to manipulate people and all this stuff. And so it's just really interesting because it is it's just, if you're going to manipulate them less, if you're more aware of what you're doing and you're more aware of your own point of view. And the last thing I want to say about that too is the other thing that seems really scary, and why I said, creative work is not a test, is that, there is this nice edge that you're walking, your positionality, like you can only tell the story that you can tell. You can make all of these efforts to make it as broad as possible and bring in humility. But there also is a story, like, I have to tell the story that I'm telling. I just have to be really aware it's not the only story that could be told with this material. There's like a million. This is the story I'm telling. So.
Thank you.
Thank you for your question. Oh, no, I think you did that. But yeah.
Hi, my name is Sarah. I'm a clinician from background and a researcher. I'm doing my PhD in public health. Yeah. It was very exciting listening to your talk about, looking at it from the paradigm of public health and storytelling. And I was really excited. My first question to you is, how did you get into, the storytelling aspect of public health? Because that's very interesting. Yeah. So from my master's work, I focused on quantitative research, and that's more like looking at fixed evidence and thinking that, reality is fixed. And it's based on numbers, and that's just one fixed mindset. And now when I'm doing my PhD, I'm doing a mixed method study, both with a quantitative and qualitative. And when you look at qualitative work, you think about that. All right, reality is different. It's everybody's. You have to think about different perspectives, and that kind of opens your mindset a little. So what do you think about storytelling and qualitative research? What is your take on that?
So I'm gonna go back to I'm gonna back into your question because I can tell you how I got into and blended these two after.
Yes, thank you.
This idea of like reality being fixed or it not being fixed is really, really such an interesting question. And one of the things that I found useful in my teaching in thinking about like, is this story just your truth? Like, what do you do with the data? Because like the data is real. I mean, it should be real, like if it's done well, right? And so it was the Truth and Reconciliation Commission in South Africa that had like the 4 levels of truth that I think is a really interesting, good reference point. There's the forensic truth that, there's a communal truth, there's a narrative. And so the way that I talk about it is that you can't ignore the friend, and people did do things to other people. The forensic truth is real, and it's irresponsible and unethical to like be like, well, that's not my truth, tough. But like there are all of these other perspectives that take into account that and ways to tell the story that are kind of communal. And one example that happened in my class a few years back that I always thought was interesting was I had a student that was working as a nurse in the lower 9th ward after Hurricane Katrina. And she was working in predominantly African-American community with elderly people. And a lot of folks that she heard over and over again, she's like, well, the Corps of Engineers, they blew up the levees to inundate the 9th ward here. That's what happened with Hurricane Katrina. It was an intentional act to save the white parts of the city by sacrifice. And my student was really disturbed and looked at the research. She's like, but it didn't happen. Like, and people were like, I heard the explosion. And my students like, but the forensic record of Hurricane Katrina is that they didn't explode the levee. But it's like, well, where does the story start here? What is the actual story? Is it really important whether or not, why is this happening? And in fact, if you go back in the historical record, it has happened. It might not have happened this time, but it did happen. And so like the communal memory of this is also a real thing that is part of the story. You can't just start the story with Hurricane Katrina. And so the story, I think one version of the story incorporates the forensic truth of Hurricane Katrina in the context of this historical, and so like, what does it mean that people believe this now? Well, it means that there is a historical and communal memory of this kind of thing happening to the lower 9th ward. Like, that's not nothing. That is certainly an important fact as part of the story. So I don't know if that answers, but I mean, that's the kind of, when people are talking about like there's also a good essay that I often teach called There's No Such Thing as a True Story. And it's by a woman named Ellen Urbani. And it was in an online literary magazine called The Rumpus. And she talks about Hurricane Katrina in that essay. And she also talks about her own experience of domestic violence and, sort of her perspective on what happened to her when her husband tried to kill her and what she imagines his perspective on those events would be. And it's just, I think that my students are often like, well, is she saying that he didn't? It's like, no, the forensic facts are that he actually put his hands around her neck. Now, she's talking about the meaning of those facts, but she's not saying that didn't happen. That happened. So, and then how I got into, so I did public health, but I also was a creative writer. And then I went and did a Master of Fine Arts in fiction writing. I mostly write creative nonfiction now. But I remember I came back to Missouri and I was the director of the Master of Public Health program in Missouri. And one of the faculty members came into my office after teaching the graduate class, one of the sessions of the graduate public health capstone. And she had the students read about a low income housing development, I think here in Chicago, and smoking rates. And, there's some qualitative research and, asked students, capstone students in public health, what kind of interventions can you imagine might be useful to bring down the smoking rates? And, I don't know how many of you are public health students, some of you, but by the time you've done 2 years of public health work, social determinants of health are like, that's what we're doing. I mean, that is the core, like there's just nothing else really that's going on. And so my colleague was really shocked. She's like, I came in and all the students were like, well, we should teach these women that smoking is bad for you. And she's like, I don't understand. Like, and she said, and she looked at me, she's like, how do I get them to imagine the lives of the women in this study? And I thought, well, that's what fiction writers actually are supposed to do, that deep imagination. And there are ways to teach that kind of imagination. Even if you're not going to be a Nobel Prize winning writer, the imagination is useful. And so then I started blending the two, and that's really what I've been doing for, I don't know, I want to say 10 years now. Any other?
Hi, yes, thank you so much for your great presentation. I particularly enjoyed the sharing of your personal experiences. I was wondering what prompts you would use for to provide people with in order for them to start sharing these experiences that they have not talked about before and that are probably difficult to write or speak about.
So do you mean, like, I guess it's which people and in which context? Because like one of the things that, there's all kinds of storytelling work. I don't do storytelling interventions around like trauma or experience, and there's some interesting studies. Aileen Gubrium, I think she's at University of Massachusetts, does some interesting work about kind of ethics of storytelling intervention. Like how do you, as public health people who might want to do that, people have their interpretation of the things that happen to them. They may not fit your advocacy interpretation. And also it can be sort of treacherous, like if you're not a trained therapist. So I guess that's not really what I do, although sometimes things come up, obviously, because we do talk about personal writing. When I ask public health people, mostly medical students too, I just consulted on a book with young doctors writing, to write about their own experiences. And so it's more for public writing, like they know it's going to be published or available to people to read. And so is that the audience that you mean?
Yes, for example, or if you're working on these interviews in Sierra Leone, like what questions would you ask?
Oh, I see what you're saying. Yeah, so that's interesting. I haven't, I didn't do the interviews, and that was not part of my role. I was just imagining the things I was interested in were sort of, how art and literature, because grieving, like how people process and grieve and express and connect with people around things that we tend to push out of the realms where we have all of this power, right? So I want to find a way to bring those things back in so that we can use some of that power to make changes. I'll tell you one prompt. I don't know if this is going to answer your question, but it's a really fun prompt if you're teaching personal writing at all, especially people who have a subject matter expertise. So my young public health students, they're often writing about issues they don't have a lot of work experience with. So, and obviously it's their responsibility to do a lot of research, not just to opine on things, but they can end up feeling like, well, who am I to say anything about anything? And so I do have them do an exercise, a prompt, and then I teach a workshop for overseas medical writers, which is how I met Jude and Chinaza through this University of Iowa International Writers Program. So I do this with them too, but it's called the List of Odd Knowledge. And I just say, well, I want everybody to make a list of 10 things, 1 through 10, on a specific topic that you would not expect the rest of the room necessarily to know about, but that you know about in detail because of your life experience or your identity, something that happened to you, something that you're interested in. There has to be 10 things. And so I'll get everything from, somebody saying, these are 10 things that I know being a non-binary person walking into a room full of strangers. Like, how to find people that might be allies, like this, and like, okay, the next person will be like, these are 10 things that I know, more specific is better, about raising minks, because I grew up on a mink farm. And, and you have them read the, any hole that's big enough for their head, they can get through. And you're like, what? Somebody, so like, but you know, somebody like growing up with a parent who's a theater professor, or, you know, somebody who like was a shepherd. And what's really, really interesting is, first of all, the reaction that you get when you get really specific about things that people don't know about is like attention. So right there, people, if you're specific and concrete, you have a position from which to speak about yourself and the world. And then you can start making connections between what you care about and what you've experienced and the thing you're writing about. It might just be a metaphor that people are like, wow, okay, I can see that now. And it might be because you have an experience that other people may not have had, and you can speak from experience, but maybe it's just because you're really, really interested in something because of where you came from.
Thank you so much.
Thank you very much for having me.
Thank you so much. I feel like what I want to know is, how do I figure out when I interact with my patients, whether or not they juggle? But, you know, not exactly that, but like, how do I get there? And I love that idea of just humanizing everyone. And in medicine, we struggle a lot with like the anti-bootstraps mentality, which is exactly what you said about your public health students. So it's like, what questions can I ask in like the 25 seconds I have to like get to like, I'll win if I get to juggling, you know, or something like that. But thank you so much. That was like, I think all of us were really quiet for a minute because we don't put our heads into the space, and it's really critical and very critical in global health. So thank you so much for that. Right now we have a break until 4:30, and then we come back to hear Juliet Sorensen speak. So you can go to the bathroom, take a break, look at some more posters, but do come back. Thank you.
Okay. It doesn't just make it not sound as true. Okay, then that's okay. Okay, we'll stick with that. Okay. So one of my favorite quotes about tradition, which is one that Alex and Kate and Olivia, the alumni of Health and Human Rights, may remember. Tradition per se has no positive or negative significance. There are good traditions, bad traditions pilloried in such famous literary stories as Franz Kafka's In the Penal Colony and Shirley Jackson's The Lottery. Bad traditions that are historical realities, such as cannibalism, foot binding, and sati. And traditions that from a public policy standpoint are neither good nor bad, such as trick-or-treating on Halloween. Now, this is a quote from the Seventh Circuit Court of Appeals in the year 2014. No Googling permitted and Health and Human Rights alums excluded. Would anyone care to guess what tradition this court is discussing? They're discussing the tradition of marriage between a man and a woman. And this was the Seventh Circuit opinion striking down laws banning gay marriage in Indiana and Wisconsin. And one of the arguments advanced by the Solicitor General of Indiana was precisely that the law should remain on the books because it was a tradition. So while the law is shaped by historical forces like tradition, that law may not be on the books because it is good from a public policy standpoint, rather simply because. And that reminds me of the parable of the little calf. I didn't realize that the keynote you heard before me from Lisa was going to be cutting edge literature. This poem is not cutting edge literature, but it conveys the point that I want to make. It's called Calfways, and I actually don't know the author. And in spirit of poetry's oral tradition, I'm not putting the text on the slide, so you'll just have to listen to my words. One day through a primeval wood, a calf walked home as good calves should, and left a trail all bent askew, a crooked trail as all calves do. This trail was taken up next day by a lone dog that passed that way. And from that day over hill and glade, through those old woods, a path was made. And many men wound in and out, and turned and bent and crooked about, and uttered words of righteous wrath, because 'twas such a crooked path. But still they followed, do not laugh, the first migrations of that calf, and through the winding woodway stalked, because he wobbled when he walked. And for 2 centuries and a half, men trod the footsteps of that calf. For men are prone to go it blind along the calfways of the mind and work away from sun to sun to do as other men have done. So it may be just because that we find ourselves on a highway of law informed by tradition, by bias, by prejudice. And it is incumbent on us as global health professionals and advocates to ask ourselves whether that is indeed the case. So let's speak now to a timely opportunity for advocacy in global health that may be at odds with a law on the books that may well be grounded in prejudice, bias, and tradition. El Salvador outlawed abortion in all forms and circumstances in 1997. Previously, the Salvadoran Penal Code permitted abortion under 3 circumstances. 1, to save a woman's life. 2, if the pregnancy was a result of rape or sexual relations with a minor, and 3, if the fetus carried severe abnormalities. Since 1997, however, El Salvador's penal code has completely banned abortion under all circumstances, providing for a potential sentence of between 2 and 8 years imprisonment for women convicted of obtaining an abortion. The penal code also criminalizes performing an abortion and provides for a potential sentence of 6 to 12 years imprisonment, as well as professional disqualification. Finally, the Salvadoran Penal Code criminalizes those who support a woman in obtaining an abortion, whether through economic or other tangible resources, with a potential sentence of between 2 and 5 years in prison with an enhancement of an additional 1/3 of the penalty if the person assisting the woman is her parent. These criminal provisions relating to abortion are among the most severe in the world. And there's more. In 1998, 1 year after the amendments to the Penal Code, the Salvadoran government also amended its constitution to recognize the right to life from the moment of conception rather than birth. What did this mean? Practically speaking, this revision to the Constitution allowed El Salvador to prosecute alleged abortions as aggravated homicide. As you can see on the slide, these revisions to the law also included a reporting requirement specifically for healthcare professionals. The Penal Code provides for fining any healthcare professional for not reporting abortion and pregnancy-related suspected aggravated homicide to public authorities within 24 hours of becoming aware of the suspected act. So after these changes to the Constitution and the Penal Code occurred, the government of El Salvador began not only to prosecute abortions, not surprisingly, as this was indeed the law of the land, but they also began to prosecute poor pregnancy outcomes as aggravated homicide. Whether this was the result of shoddy policing, of a collective suspicion that obstetric emergencies were in fact just that, or a cultural atmosphere of suspicion that something like a stillbirth might even happen to a purportedly loving mother is unclear. But it is a fact that anti-abortion advocates specifically began to target those suffering late-term obstetric emergencies. By way of example, a 2001 editorial in El Diario de Hoy described the fetuses of women who suffered obstetric emergencies as, quote, human beings who await the sweet hands of a mother, but what they find instead are the talons of soulless women. By 2005, fast forwarding several years, the Attorney General's Office of El Salvador had begun to encourage law enforcement officers to locate the deceased fetus as part of their investigations following obstetric emergencies that were classified as suspected abortions, in order to upgrade initial charges of criminal abortion to aggravated homicide, depending, according to the guidelines from the Attorney General, on whether or not the police investigation showed that the fetus had breathed upon exiting the womb. And medical professionals began to report patients they said they suspected of having an abortion, despite this information often being acquired in contexts where it ought to have been protected by medical confidentiality. So I'll take a moment to describe for you a case that is representative of all of these phenomena. Manuela, which is a pseudonym used to protect her family, was a 33-year-old Salvadoran mother of 2 when she fell at home and suffered a stillbirth. Manuela was taken to the public hospital by her parents after hemorrhaging, where she lost consciousness. So the facts can be reduced to a depressing series of bullets: stillbirth, hemorrhage. She awoke handcuffed to a hospital bed after regaining consciousness. Hospital workers had called the authorities, accusing her of inducing an abortion, and police arrived to interrogate her whilst she was still shackled to the bed. The treating healthcare professionals had reported Manuela to the police, and the physician explained that the reason she had reported Manuela was that the information provided by the patient appeared not to match the clinical diagnosis. The patient was attended, this is in translation, for a miscarriage, but her examination allegedly revealed that there was a clean cut in the umbilical cord and that it was not torn, although a different visual inspection, according to hospital records, found the opposite. It was at that point that Manuela was handcuffed to her hospital bed and interrogated by both physicians and police officers as to whether she induced an abortion to hide, according to notes of the interview, her infidelity. Manuela's mother and father, both indigent and illiterate, were asked to place their fingerprints on the document reporting a suspected abortion with no explanation of the document's contents. Manuela was charged and convicted of aggravated homicide. In 2008, she was sentenced to 30 years in prison. Manuela is no longer living. She died after 2 years in prison of untreated Hodgkin's lymphoma. I wish I could tell you that this case was a tragic outlier in El Salvador or otherwise. That's unfortunately not the case. My colleague Alex Tarzakan, third-year law student Meredith Heim, and I reviewed data from 38 Salvadoran cases, including Manuela, all of which appeared to be wrongful convictions of aggravated homicide when in fact an obstetric emergency had occurred, all of which had been filed since the absolute ban on abortion and constitutional amendment of 1997 and 1998. We then filed a friend of the court brief, an amicus curiae brief, in the case of Manuela versus El Salvador, brought before the Inter-American Court of Human Rights by the Center for Reproductive Rights, the Colectiva Feminista para el Desarrollo Local, and the Agrupación Ciudadana por la Despenalización del Aborto, two courageous Latin American reproductive rights organizations. We made the following points in our submission to the Inter-American Court. El Salvador's complete ban on abortion creates a climate of fear among medical professionals and consequently threatens women's health. The abortion ban appears to be the second cause of maternal mortality and the third cause of mortality among adolescent girls in El Salvador. Suicide accounts for 57% of the deaths of pregnant females aged 10 to 19 in El Salvador. We argued that there is a pattern of selective enforcement of laws that already discriminate on their face. And what do I mean by that? A law that outlaws a practice that only applies to a particular group of people, in this case, people who can conceive and bear children, is indeed discriminatory on its face. When that law is selectively enforced, as it is in El Salvador, it is enforced against the poor, against the young, against the rural. This law does not lead to the elimination of abortion. Rather, it leads to an increase in maternal mortality and wrongful convictions. And indeed, over the past 2 decades, El Salvadoran courts have convicted and imprisoned dozens of women for up to 30 years because they have had an abortion or an obstetric emergency. The climate of fear that I mentioned earlier is what incentivizes healthcare officials reporting what may or may not be actual suspected abortions to law enforcement. And that is indeed written into the law, as I described a few moments ago. We further argued that El Salvador's criminalization of obstetric emergencies violates some key human rights that are part of multilateral treaties that El Salvador is a party to. Number one, As I said a minute ago, the right to be free from gender-based discrimination. Number 2, the right to health. Number 3, the mandatory reporting of women suffering obstetric emergencies violates the right to privacy. And the subsequent prosecutions in many instances result in violations of the right to liberty and a fair trial, what we in the United States would consider to be key violations of the right to due process of law. We noted the Salvadoran court's reliance on the remains of the fetus as purported forensic evidence, and sometimes pointing to indications that there had been air in the lungs to convict a woman of murder, while disregarding systematically factors that might increase the likelihood of an obstetric emergency, and also disregarding factors that might result in fetal death. In November, the court ruled that El Salvador was indeed responsible for Manuela's wrongful prosecution and death in prison and must pay reparations for her family. In my own opinion, unfortunately, the court stopped short of ordering El Salvador to decriminalize abortion. But the ruling was significant nonetheless, as the court ordered the government to take measures to ensure doctor-patient confidentiality, and also to ensure that Salvadoran women are not unjustly persecuted for seeking healthcare for obstetric emergencies. And yes, we in the law work incrementally. Most importantly, the case did bring justice for Manuela's surviving family members. It is true, however, that many other Salvadoran women remain wrongfully convicted and imprisoned for having sought medical treatment for their obstetric emergency. In the words of International Planned Parenthood Federation's Irene Donadio, El Salvador is the golden model for reproductive bullies. It's something they hope to mimic in the US and in Europe. So this question of transnational reproductive bullies is an apt segue to matters here at home. This aspect of the talk I would not necessarily have anticipated giving, certainly not in this fashion, 1 month ago. Last fall, Alex and I filed another amicus brief, this one co-counseled with Northwestern Law School's Supreme Court Clinic and filed with the US Supreme Court in a case that we've all heard of now, Dobbs versus Jackson Women's Health Organization, also known as the Mississippi abortion case. We argued in our friend of the court brief that near categorical bans on abortion will not result in the elimination of abortion, as I said a moment ago, but they will have a significant, real, and negative impact on the health of pregnant individuals. We pointed out that the worst such impacts would be borne by marginalized groups, including here in the United States, people living in poverty, and by Black, Indigenous, and other people of color. We argued that countries around the world allow abortion on broad grounds and pointed out that just a handful of countries, indeed representing only 5% of women of reproductive age around the world, ban abortion without exceptions, El Salvador being one of those. International law is consistent with those trends, and international human rights law recognizes the well-known risks created by restrictive abortion legislation and requires countries to ensure abortion access. Well, we don't know how this story ends, but we do know of a chapter that was never intended to be published. Earlier this month, a draft opinion based on early opinion voting by the justices was leaked to Politico. The draft opinion overturns Roe versus Wade, which, as you all know, established a constitutional right to abortion back in 1973. The year I was born. There are several possible outcomes when we look at the tea leaves and what might happen when the justices issue their final opinion later this year. You can see them on the slide before you, and Kaiser Family Foundation gets credit for the graphic. Possible outcome number one is that Roe is overturned. This is the navy blue box, and allows states to ban abortion before viability. Given the current state of the law across the 50 states today, it would appear that 18 states would immediately ban abortion in all forms. 13 states and Washington, D.C. would recognize the right to abortion, and 22 states would likely pass new laws addressing abortion access. Option number two. The Supreme Court allows states to ban abortion pre-viability when the ban does not burden a substantial number of people seeking abortion care. This is a middle ground of sorts, and it could potentially lead to new cases to review each state's abortion laws and the facts of how many people are burdened in that state. Finally, the Supreme Court upholds Roe versus Wade and does not permit states to ban abortion pre-viability. It's possible in that instance, as the court often does, it could signal its willingness to hear future cases, considering whether states can ban certain procedures or impose new requirements on patients and providers. So, in summary, if a woman's right to choose is not protected by the Constitution, and that is the outcome in Dobbs, or by federal law, as it appears that Congress does not have the political will to act, in our federalist system, it's up to the 50 states to do so. In Louisiana, a bill was introduced 2 weeks ago that would have subjected Louisiana women to murder charges for having abortion. Indeed, El Salvador's precise situation. That proposed legislation has since been withdrawn. In Texas, a group of Republican state lawmakers are preparing a plan that would keep private companies from helping employees seek abortions outside of Texas, should Roe versus Wade be overturned. And just in case you use ride shares, it was actually Lyft that was named as a company that had communicated to its Texas drivers that it would be willing to support them in reproductive choice outside the state in this eventuality. If the Supreme Court strikes down Roe versus Wade, a state so-called trigger law would ban nearly all abortion procedures in Texas, with the only exceptions being to save the life of the pregnant person or to keep them from serious impairment. And most recently, the governor of Oklahoma, Kevin Stitt, last Wednesday night signed into law what is to date the strictest abortion ban in the United States, making Oklahoma the first to in effect end all access to the procedure. Just to be clear, it does not criminalize, it does not provide for criminal penalties. What it does instead is provide what I think of as a civil vigilante system. It gives a private right of action for individuals to sue people that they allege have gotten abortions. The law in Oklahoma prohibits abortions with exceptions to save the life of a woman or if the pregnancy is the result of rape or incest reported to law enforcement. When do we advocate? Now. Now is the time and the place for professionals in global health to advocate against the criminalization of obstetric emergencies, and indeed the weaponization of reproductive health and choice against women. The policy goal at stake in the proposed legislation in Texas and Oklahoma that I've just described is nothing less than women ceding their liberty at the moment of conception and thereafter becoming wards of the state for the duration of their pregnancies. I only wish that I was speaking in hyperbole. Each of you here today has the training and experience to be an advocate for global health, whether that entails upholding the law or seeking to reform it. when and whether to advocate, when it is right, and when it is just. And with that, I welcome your questions. Yes.
So I did have I guess a procedural question. So when looking at the case in front of the Supreme Court, it does seem like judges write a lot about like, oh, historical policy, but isn't the question in front of them, is this legal? And all those questions aren't really pertinent. Or can you, similar to what we were talking about earlier, just pick, there are many different legal avenues that you could pursue. And so you're picking the one that also aligns with policy, tradition, and the like. But is, at the end of the day, isn't it the question in front of them, is this constitutional? Hence, we don't have a right to privacy that was an assumed right. So can they use these other factors or not?
Yes and yes. So that is the question. Even for the non-lawyers among you, I encourage you to read the draft opinion. I do want to share a caveat. My own experience practicing before the Supreme Court is very limited. But Alex's and my colleague, who's the director of our Supreme Court clinic, actually had a few words of caution, which I found comforting, which is that it was, first of all, it's bold and fascinating, and we can gossip and speculate about the leak itself. But he did caution that it is just an opinion draft, and I think the justices are upset about the leak because the court is an institution and it's undermining the institution. But it is true that opinion drafts are very often subject to change. Now, that can inform your speculation about who leaked it and why, right? Are they furthering the goal that ultimately Roe be overturned, or are they furthering the goal that it be upheld? And is it backfiring in this moment? In any event, if you read the draft, which appears to be authentic, and that's what the court has said, and it was authored by Justice Alito, I would say two key takeaways are the following, and he really hangs his hat on both of them. One is, you can take my opinion for what it's worth, but I'm speaking before you on a podium, so I'm going to give you my opinion. One is silly, and one is not totally meritless. Okay, the silly part is his heavy focus on originalism. This is because then the question becomes, and is he signaling or threatening, and is there a basis in jurisprudence to extend that originalist analysis to overturn Obergefell versus Hodges, which is the Supreme Court gay marriage case. Let's go back even further in time and focus on reproductive rights. Griswold versus Connecticut, which was the case challenging Connecticut's ban on contraception. Were birth control pills available at the time of the founders? Certainly not. Does it really matter for today's analysis? And so, to bring this into another raw and contemporary debate, the question of the Second Amendment, of course, and what the founders intended, and to the extent to which it has any relevance in today's society. Okay, the second point, which is actually not without merit, is that it is true that Justice Blackmun in Roe was being creative in finding a constitutional right to abortion. It really was, it was not the only opinion in which he articulated a zone of privacy. It is certainly for human beings, when we think about a social contract and private life, it is eminently logical. But the Constitution is a constitution of limited enumeration, and the federal government is a government of limited powers. And they didn't speak a whole lot about privacy. Now, one thing they did speak an awful lot about is liberty, personal liberty, civil liberties. To my mind, it's an extremely logical extension to extend that freedom of association, which is actually grounded in the First Amendment, to personal choice and reproductive choice. I can spend my time doing what I like with whom I like, and that also extends to bodily control. The right to privacy was always somewhat fragile, but it was accepted because it was pronounced by the Supreme Court, and this line of jurisprudence was built out by it. Is that responsive to your question, Shannon?
Yeah, so essentially they are saying the right to privacy was an assumed right. We don't find it in the people, Justice Alito, if we read his draft opinion, is it that the right to privacy is actually not in the Constitution. Other judges before us kind of made this up. Even though we usually follow tradition, we're going to back away from that and say that we don't find that this is a constitutional right to privacy, although he went to great lengths to try to make us feel better that all these other things that were assumed from that right wouldn't fall, but they probably would.
That's exactly right. I mean, one of the reasons I think that the opinion is weak is because it draws comparisons and seeks bases of support in ways that are inconsistent and inapt. So one example, because of course this would be an instance of the court overturning itself, right? That's what we're looking at here. Now it does happen, but it's a big deal when it happens. And so Justice Alito says, well, this of course is not the first time that the court has overturned itself. And if you read the opinion, you will see that what he points to, which I find quite rich, are civil rights cases. So he says, look, Brown versus Board of Education overturned Plessy versus Ferguson and the separate but equal doctrine. And he said, and we're so proud of that. And therefore it's time with Dobbs to overturn Roe. Grossly inconsistent if you're looking at this through an arc of human progress lens.
I can yield the microphone and I'll hold myself.
Thanks. That was very interesting. My question is why you didn't, or have you, well, would you consider taking it to an international court? Because there's some really interesting parallels in what we've signed in the past and how they elevate above possibly even our own previous history of laws. So your example for El Salvador was that you took it to an international court, and people in Europe are starting to take cases where, say, the Navy of Italy has extended its power, and so extended essentially the laws of Europe all over the Mediterranean as an example, which I think is powerful in an idea, but I don't know if it would work in this case.
That's a great question. Thank you. So first of all, I want to be clear that we did not represent the parties to the case, and extraordinary credit goes to the Center for Reproductive Rights that I meant. Really, they are the groundbreaking advocates, both from local to global in these cases. We're the so-called friend of the court briefs, they're a little bit of a fiction, to be honest with you, because they're supposed to be non-adversarial. They're filed, they're often scholarly, and they're filed to educate or inform the court. Now, the fact of the matter is they're totally part of an advocacy strategy. And, as we filed friend of the court briefs taking one position, believe me, there were friend of the court briefs filed taking the opposite position as well. So the United States playing in the international law sandbox doesn't like to do that, but it is not impossible. It is not possible when it comes to the Inter-American Court of Human Rights. That was the case that the court that heard Manuela's case. The United States is a member of the OAS, the Organization of American States. Indeed, OAS headquarters is in Washington, D.C., but we have not opted into the Inter-American Court of Human Rights, which is the human rights mechanism of the OAS. I guess we're too good for that. However, we are parties to both the Convention on the Elimination of the Discrimination Against Women, and also, importantly, the International Covenant on Civil and Political Rights. And both of those are multilateral treaties that do have enforcement mechanisms. Where the rubber hits the road in international judgments is really where it comes to enforcement. There may be a ruling pursuant to our system of sovereignty. There's very little that an international judgment coming from one of these bodies can actually do to force the hand of a party beyond the public pressure, which a large, powerful, and wealthy country often feels entitled to ignore. That said, it's a totally important strategy, which is part of a larger one.
Thank you so much, Ms. Sorensen, for your talk. I am from Pakistan, and I don't want to name any countries, but just talking along the lines of reproductive rights, there are still some cultures where women are kind of, blamed for producing a female child versus a male child. And in those circumstances, just how so the culture ends up treating them. Some women might choose this along the lines of abortion, just because of the fear of producing a female child. So it is along the same lines of, reproductive health, and I'm don't advocate for it, but there are still some cultures which are so behind in this race that women are blamed for this, which is entirely not their fault. And I feel like, being a public health person, we need to advocate for that as well, on the gender selection as well. So just a comment, it's not a question, but I just wanted to make that comment.
Yes, thank you for your comment. And of course, the deep-rooted and pernicious problem that you articulate in some parts of the world is deeply troubling and complex, and requires complex cultural change to unroot and unseat. But you're also correct that it, like what occurs in El Salvador that I have described, it does involve an objectification of women. The language that I quoted from the editorial about talons, the mother of a stillborn child has talons. What does that mean? It means she's inherently unmotherly, unfeminine. A woman is somehow less than quality if the child that she bears is a girl and not a boy. It is at its heart rooted in profound gender bias. And that is the deep-seated cultural change, which goes far beyond the law and the books. Kate.
So many things in the past month made me want to be an advocate, right? For figures. But of course, not a legal professional. But what I'm wondering is, especially when it comes to the law, how can non-lawyers be the most productive advocates? Besides giving money and voting, like what do you see in your experience, especially when it comes to advocating for a law or not a law? What can we do that's most effective?
Yeah. So this room contains great power and the potential of force and influence. Individual actions are one thing, collective action is another. So let's start with the individual. I actually like to start with the old-fashioned route. Write your member of Congress. It is their job to listen to you. You are their constituent, and they do read letters from constituents. They have legislative aides. That is their job. You'll get a response back. It's filed away in the constituent from my district wrote a letter about Dobbs file. Okay. I know that many of you may find professional associations tiresome. Sometimes I do. The American Bar Association is, I don't even know what it is. It's more bureaucratic than the United Nations. But you know what? They have clout. They are organized. They have dedicated lobbyists on Capitol Hill. So at the risk of sounding sort of completely strategic, find your interest group, align, and then leverage that collective action. It should be based on your, gotta back up to the final slide, your experience, your training, and your decision of what you want to advocate for. But there is a sweet spot where all of those come together, and it is possible to translate that into impact.
Can I just follow that one up? Because really, so thank you so much for this, but we have a lot of, so many of our learners in the Global Health Clinical College program are looking for ways to advocate. They're typically medical residents or trainees. And as medical professionals, I know there's many non-medical professionals in the room, but as medical professionals, what can we do with that power, like specifically as individuals who are doctors?
So, I mean, I think that one thing you can do is something that I know that you and Shannon and all of the other physicians in the room already do, which is education and outreach as part of your daily, not only your teaching as educators, but your clinical practice as well. Again, you speak for your training and experience puts you in a position of being an expert, both perceived and in fact. So you have something of a bully pulpit, and credibility is assigned to you. I know a little bit about congressional testimony related to various topics on human rights. I will tell you, when Physicians for Human Rights testifies before Congress, those members of Congress really sit up and listen because of the actual credibility, I'm sure, but the perceived credibility of who is submitting that testimony. So Ashi, that's probably a very vague and general answer, but I'm going to leave it to you to translate and apply in your own daily life. What do you think?
Like a list, like everyone sign up for Physicians for Human Rights. Like, where can we go so that we can sign up to testify? Like, go to Springfield and wear our white coats. Like, you know, I need like a concrete list of things for our like OB fellows who talk about this and struggle with this all the time. And I'm really speaking for our small group of learners who's like ready to do this, but someone sort of needs to tell us what to do.
Yeah, I mean, I will just say one other thing, you know, it seems trite to reduce it to money, but Planned Parenthood is on the front lines. They operate under actual risk to their personal security. You know, if you all have ever seen the Planned Parenthood here in Chicago, it looks a little bit fortress-like, and for good reason. So donate your time, donate your money, because they need it.
So I mean, that is from my perspective. I'm a researcher and an MSc student, and really time matters. Money matters too, and professional, you know, like whether you're going and doing research and using that or testifying somewhere, but also your time. I think people overthink that, but just basically getting people into study safety is now much harder than we have been in the past. And that's happening here on our student.
Thank you. It's Julia, right? Okay. Good. All right. I'm not going to make a connection from the podium. Okay. Other questions, comments? Shall we call it? Okay.
Thank you so much. No. A couple of quick announcements before we get to the awards ceremony. We wanted to announce that we have the Institute for Global Health's First Friday series is coming up. Friday, June 3rd, we have a very distinguished speaker at 12 p.m. Fredros Okumu will be speaking on investigating persistent malaria transmission in Tanzania. We'd love for you all to join us. It'll be over Zoom. We also are hosting a Ukrainian scholar who's an expert in mental health. And that will be Monday, June 13th at noon. And he'll be speaking about mental health care in the Ukraine from the past to the future. And this is supported by a Buffett grant. And thank you again for your participation. Please join our center. And with that, we shall proceed to the atrium-ish area for our awards, and then our small bites and wine and non-alcoholic drinks and things like that, and beer.